Hello, my name is Madeline Serna Marmol, and I'm Associate Superintendent of Equity, Instruction, Innovation, and Support. We wanted to present this video to staff so that you would learn more about student emotional recovery and response to trauma. Students will be returning to us with unique and individual responses to the changes and challenges that began last March. Student responses to traumatic events can impact their learning, behavior, and relationships. It is important to connect with your students, build relationships, recognize physical and emotional warning signs, engage in positive activities, create a sense of safety, and engage in discussions to process these events. Begin these discussions at the start of the school year with the students and their families. Many students will experience anxiety and apprehension, and it is vital that we focus on their emotional well-being and respond in a positive and supporting manner. Today, we begin to understand the trauma induced by COVID-19 and how to support and respond to distressed members of our school communities from the founder and CEO of Southwest Family Guidance Center, Dr. Craig Pierce. Founded in 2004, Southwest Family Guidance Center serves children, adolescents, and families in 7 counties throughout New Mexico. As the director of the Institute, he and our training team provide extensive training to clinicians, educators, New Mexico Children, Youth, and Families Division, CYFD, and other partnering stakeholders. He is co-author of our Thriving Kids and Thriving Students curriculum and programs offered to CYFD and school districts throughout New Mexico. Dr. Pierce comes with over 40 years of experience as a clinical counselor, family therapist, school counselor, and school psychologist. He is a fellow of the American Psychotherapy Association, a clinical fellow of the American Association for Marriage and Family Therapy, and a board-certified PTSD clinician by the American Psychotherapy Association. He is recognized as a leading expert in trauma-informed treatment and author of multiple books on effective parenting.
Welcome back to our second training video on emotional recovery and well-being. The last video I did was a focus on what our staff have been experiencing since the end of our dramatic school year last year and everything that they've been experiencing since and what they're facing in coming back to our 2021 school year. So today I want to focus on what our students have been experiencing since our dramatic ending of the school year on site and then trying to do the best we could to wrap it up. What they've been experiencing since then, and especially what their families have been experiencing since then, and then of course what they're facing as we start out our 2021 very historic school year. So we want to address the trauma that students are returning with, what that looks like, and how we can foster their resilience. So again, I'm Craig Pierce with Southwest Family Guidance Center. The work that I'm drawing on today is coming from our Thriving Students program that we're providing in partnership throughout the district with APS. It's a trauma-informed program focusing on social-emotional skills. So we are facing a storm this year, and in my last training, I talked about what it is that we're facing as the staff. We talked about all the uncertainty, the loss that we've experienced, the continuum of trauma we're coming from, and students and their families are coming back no differently. They're coming back with our experiences, with the same feelings that we're having of uncertainty, of some grief, of some loss, relentless anxiety, probably anxiety on a daily basis, moment to moment, more than any other emotion. We're all coming back with a little anger. We're coming back with some overwhelm or a lot of overwhelm, worry, and vulnerability. So to help us understand what it is that we're dealing with, what it is that we need to do, I like to use a concept from positive psychology and positive education field called name it, flip it, and frame it. So the name it is, what is it that we're dealing with? What's the adversity that we're facing? What's the challenge that we're facing? What's the severity of it? Maybe what's the enormity of it? What's the challenge? It's naming it not with criticism, not with judgment, certainly not without blame. It is what it is. We need to see what we're dealing with. When we can see it, we know what it is we can do. And then the flipping it is, what do we want it to look like? How do we want the school year to end? How do we want to navigate through the school year? What do we want it to be? How do we want it to end? And I'm hoping that we will all be in a stand that will be for resiliency, that at the end of the school year, our students will have not only survived, we will not have only survived, but we will all come out of the school year thriving. And then we need to frame it. In order to have that resiliency, to come out with achievement, how are we going to do that? What will that take? What's needed? So let's start by naming it. Now, again, in the last video, I talked about, as staff, we're coming back from a school year that was incomplete and sort of a traumatizing ending, no different for our students and their families, working in a way that none of us are trained for, in an unprecedented time where everybody is being affected in our community, no different for our students and families, facing daily uncertainty that has us feeling incredibly anxious, worried, maybe depressed, fearful, and very impatient. No different for our families and our students. In the backdrop of all that is all the social and political tensions going on and unrest, and no different for our families and kids. And a lot of what's referred to as caution fatigue, the fatigue that we feel in trying to avoid getting COVID-19. A lot of anxiety fatigue, compassion fatigue for others that we're worried and concerned about that we see. We are witnessing a lot of disparity. Who's being most affected, impacted by COVID? A sense of helplessness at times, a lot of financial impact to our families, on our budgets, on their budgets, and our waves of emotion and the waves of their emotions. Now, we're all experiencing that, and to be really empathic as our students show back up and their families are showing back up, whether it's online or whether it's at our doorstep, we need to keep in mind that they are experiencing all of those same things, and in many cases, even greater. So I want to keep in mind, and I want to have us keep in mind, that we all know what trauma is to a community. We think of things like, when the World Trade Center was hit, we know that that was a trauma to our country, certainly to New York. When there's a school shooting, we know that there's an incredible impact on that school and on that community. But I want us to be clear that what we're showing up to this year is also trauma. Everybody is being affected on some level on the continuum. There is no family, student, or any of us that aren't being affected. Obviously, some profoundly more than others. But we need to keep in mind that an event is traumatic if it is extremely upsetting and at least temporarily overwhelms our internal resources and is stretching, if not exhausting, our external resources. And I think that we can all agree, all of us and the students and families on a daily basis are feeling some level of mild to severe overwhelm of their internal resources and certainly of their external resources. So we are all on a continuum experiencing trauma because we are all upset and we are all dealing with internal overwhelm. So let's talk briefly about what is the impact of trauma, abuse, and neglect. Now, I've done a lot of training in many schools, and some of you have heard my trainings. And if you have, you know that I like to talk about trauma through the story of Amy and Tommy. Now, Amy and Tommy are on a continuum of 1 to 10, where 1 to 3 are those kids, students, who get pretty much everything they need for healthy development, for attachment and brain development, keeping in mind that brain development and attachment go hand in hand. The greater and more secure the attachment, the greater the brain development of all parts of the brain, and in particular the social emotional part of the brain. So Amy is the one that got predictable pattern, repetitive, and attuned caregiving, all that she needed for healthy development when she shows up to our schools in kindergarten. Tommy, on the other end of the spectrum, is in the 7 to 10 category. And in his case, he's probably a 9 or 10. This is based on a true story of a student that we worked with in our agency. He's had already, by 5 years old, multiple adverse childhood events, witnessing domestic violence, being the recipient of child abuse, physical child abuse himself, witnessing 2 of his sisters being sexually abused, and likely being directly the recipient of that himself. He's really high on the continuum. So all of us, all of our students show up on that continuum, from getting everything we need to in the middle. A lot of students have some things happening, some chaos or some events, but they got enough of what they needed that they can still draw on a lot of resilience to those students in the 7 to 10 category with all the events that really minimize their resilience. So as we look at those students and compare them, it's just helpful. Now, I did some in-depth assessment, and I can't go into all that takes, but some in-depth assessment on the impact of all of that trauma that Tommy received as compared to Amy. And we come up with this chart. I apologize, it's a bit sexist, blue for Tommy and pink for Amy, but they're simply put are 4 domains of the brain: the sensory integration and the self-regulation, kind of the lower to lower middle part of the brain, self-regulation being emotional regulation and physical regulation. The relational part of our brain, the part of our brain that can pick up on social cues, wants to attach, seeks out attachment, has the social skills to be able to reciprocate and attach, has the ability to empathize at the developmental stage that they are. And all of that is what contributes to our ability to work in the upper part of our brain, the cognitive part of our brain, because we can focus and we can feel secure in the skills that we have to academically achieve. So you can see the difference between Tommy and Amy in all 4 categories. This is them showing up in kindergarten. He is at half the capacity as she is starting kindergarten, where that teacher is expecting him to be a 5-year-old, being able to do developmentally what a 5-year-old can do. Now, if we think about those kids in the middle, that 4 to 6 area, they might be a little bit higher in all of those categories, but they will still be significantly different than the Amy's. What's important about that this year is keeping in mind all of our students are coming back to us on the continuum that they are. Those that we were concerned about prior to COVID are coming back with a history of traumas that they have been having. Everyone, even the Amy's, are coming back with at least a lot of stress, family stress, their own anxiety as they face the school year. The difference is Amy is going to have a lot more resiliency and skills to be able to manage the emotions that she will be managing than Tommy will. Now, we want to think about how they are going to show up and function given that disparity. So we all are in the part of the brain, we're operating from the part of the brain where our emotions right now are living. If we're calm and regulated and feeling secure and on task, we're in the upper part of our brain, the frontal cortex of our brain. As we get a little bit more anxious or feel a little bit more threat, or we're kind of sensory overloaded, whatever it is, we go to the more alert part of the brain. We start to go to the middle part of the brain as we get more and more anxious. If something triggers us emotionally, we go to that emotional part of the brain. And if we're really triggered with a physical threat or with an emotional threat, we go even to the fear part of our brain, which is the mid part of our brain. Keeping in mind that we respond in the part of our brain very much the same way to emotional threat as we do to physical threat. So we want to be aware of, as the staff, when we're showing up, where are we in here? Are we showing up to school in our emotional part of our brain because of the stressors that we're coming from home with? And if we are, how can we take a deep breath before we start the school day or the class? Because we want to be up here so that we're not in that state and reacting to our students. So we want to be thinking about where is the student, whether it's an Amy or a Tommy, where in their brain are they? And we'll talk more about that in terms of regulation. Let's think about the common triggers to being into the emotional part of the brain. When I've taught this in the schools, I talk about Tommy's and showing up to the triggers in a school. When we come into a school building, no matter what the level is, there's a lot of unpredictability, how other people are going to behave, whether my teacher's going to be there that day or not, an unexpected change, transitions. Even in elementary school, much less middle school and high school, there are all kinds of transitions. Vulnerability to rejection or being socially rejected and even socially shamed, huge trigger. Loss of control, a sense of I'm not in control, I'm melting down, I'm getting in trouble, or the lack of control of what's happening in the classroom. I can't control what other students are saying and doing toward me or threatening me with. I can't control the changes that are being made. I can't control my teacher as much as I'd like to and as much as I sometimes try to. Being confronted with authority and limit setting and loneliness. Students like Tommy in particularly feel very lonely. And I just, as an aside, want to mention that the number one health risk factor that's being identified internationally is loneliness. Loneliness is the number one health risk factor, mental health and physical health. So much so that in the UK, they've now created a ministry of loneliness. So again, a lot of our students are showing up in a state of loneliness and isolation. Sensory overload. You can't be in a school and not be sensory overloaded. Have you been in the hallways, in the cafeterias, and even in our classrooms? So those students who are really struggling with sensory integration issues or physical regulation, hugely a struggle. Heightened emotional states. Every classroom, every school is filled with heightened emotional states. And think about the school year that we're coming back to this year, heightened emotional states on steroids. So what are students coming from? Just keeping in mind where we're all coming from, they're coming from an incomplete school year, the impact that social distancing and isolation for their families means to them, mild to severe traumas and impact on their family from home, intensified emotions without the mature internal resources to deal with those emotions, and frequent, if not constant, overwhelm. A lack of structure, caregiver distress, emotions that are, and feelings that they don't know what to do with. What our students are facing and launching into are coming back to school wearing masks, crazy, unpredictable schedules. We don't even know what the schedules are going to be, where we're going to be, much less them. And they're coming back to wonky teachers. Now, it's not just the teachers that are wonky. We're all wonky this year because we're all facing stress and distress and emotional part of our brain. We're all facing uncertainty and unfamiliarity, lack of structure, and when students need it most in the developmental stage, structure, routine, and ritual is just when everything is unpredictable. So let's think about what will that look like. For our younger children, we're going to see a lot of symptoms of distraction and fidgeting, emotional dysregulation, mildly to severe meltdowns, being off task, we're going to see a lot of behaviors that if we look behind the behavior is anxiety, moodiness, and preoccupation with safety. Some of our students are going to be really preoccupied whether they're safe in that classroom or not from getting COVID because they're picking up on the anxiety of their families, and understandably. So as we look at all those, one, we want to keep in mind what's typical. A lot of those behaviors are sort of typical of kids, young children. Keep in mind that every behavior that you're seeing, behind that behavior is some emotion that's driving that behavior. So I want us to really be mindful this year. Don't focus on the behavior, focus on what's the emotion behind the behavior. Because we want to help them cope with those behaviors and or cope with those emotions. Our job is going to be to identify what the emotions are and help them navigate those emotions. Behaviors that we might see in older students are pre-adolescents and high school students. Irritability and moodiness, shutdown, kind of the shutdown, what it looks like is you can't affect me, I don't care about this. Being distracted, being emotionally reactive, anxious, being off task, preoccupied with safety, absent, either literally because they're not showing up to school or figuratively, sort of there in body but not in spirit. Now, if we think about adolescence and hormones in adolescence, all of those are pretty characteristic. So again, we need to discern what's the difference between typical adolescent behavior and how they're being impacted by the stress of this year. And again, remembering that behind any one of those characteristics is going to be an emotion that's driving that behavior. So we oftentimes need to remember to ask, I'm noticing you're having a hard time with. What are you struggling with? What do you need? How can I help you? So let's flip it. The flip it is, what do we want it to look like? What do we want it to be? What we want, what we think is possible, and our vision, hopefully, for resilience and thriving. That's what we want for the school year. So in order to have resilience, one, let's start with understanding what it is. As I mentioned in the previous training, Elena Aguilar defines resilience as the ability to encounter adversity and bounce back stronger than before, supporting us in fulfilling our purpose. We all have a purpose in showing up, and we have an even greater shared purpose this year as we're trying to navigate this historic year. And our students are having a greater purpose this year. They want to show up. We need to trust that they are showing up, wanting to do well, and that with the challenges that they're facing, there is a shared purpose, and all of us are in this together, doing the best we can. Shared purpose is a real driver to resiliency. We are not born with resiliency. We learn it from our environment. We're taught from our environment what we don't get, what we might lack. The good news is every skill for resiliency is teachable and learnable. And that's what we're going to be here to do this year and support them. Keeping in mind, the greater the resilience, the greater the ability to thrive and well-being, and the greater the ability to achieve academically. At the heart of resilience is the idea that no matter what, I see you, you matter, and you belong. I shared in the last video that an invitation to our leaders, whether it's the district leaders, the school site leaders, even the state leaders, staff need to feel like they are seen for what they're doing, what they're experiencing, that they matter to the community, to the school, for their role and what they're doing to educate our students, and that they belong, that they are welcomed here, and that they are part of something bigger this year. This is no less true for our students and our families. We need to message to them every day in some way, no matter what. I see you, you matter to us, and you belong here. And that's especially true this year for our families, and especially our marginalized families. And we need to be attuned to what they're coming from and what they're needing. So another factor for resilience is connection. Students need to feel that they are seen. Of course, they matter and they belong. Without a sense of connection, there is no academic and social improvement. So again, we are educators. We are here to teach academics. We are here for students to learn. But in order for them to learn this year, we need to pay more attention than ever to the social emotional needs so that they can show up ready to learn and be on task. Keep in mind, we are hardwired for connection. It affects every area of our well-being. And without it, there is no academic achievement. The next factor in resiliency is empathy. Empathy is the path to connection. It's open and curious approach that helps us not make harmful assumptions, helps us to forge ahead with less judgment and genuine bonds. When we're empathic, we listen and we're open. We are intentional with trying to understand the perspective of the other so that I'm less likely to be judgmental, so that I'm less likely to make a negative assumption. It's asking, what's this experience meaning to you? What don't I know because you haven't had an opportunity to share with me, or you're feeling vulnerable to share with me? It's being present in a curious, inquiring state. And the last piece of resilience is optimism. Now, optimism is a lot like courage. You know, we think of, sometimes we think that courageous people are fearless people, and that is not at all true. You're not courageous if you don't feel fear. Courage is, I feel a lot of fear and I move forward anyway. That's courage. Optimism is very much the same. I see the problem, I see the severity, I see the enormity of it, I see the challenge. And I believe that I can impact the trajectory of how things are going to go. I have an impact on change. I can make a difference and have an impact on change and a different possibility. So optimism is seeing it, and I can make a difference. And that's what we need to help instill in our families and in our students, that yes, this is going to be very hard. Yes, this is scary. I understand the fear that you have, mom or dad, in how your student is going to be affected, how they might lose ground academically or socially. But we absolutely can make a difference in the face of this adversity that we are facing in school year 2021. So let's think about some resiliency factors for our students. Caring, stable relationships, number one. Clear and consistent, predictable structures. That's a resiliency factor that's harder this year for us to provide because of all the uncertainty and the changes that we absolutely, unfortunately, may have to have. Stories of overcoming adversity. We can tell our students stories about, I know another student who's feeling, whose family's dealing with, and tell them what it was that helped them and they're being able to do. It just makes sense that you're experiencing this. I'm experiencing this. What's helping me is, so that they see that there's a different possibility. Acknowledgement of what they're experiencing. And the normalcy of what they're experiencing. We are all experiencing so much the same thing. And it really helps to know that there's nothing abnormal about what I'm experiencing. We all are, and this is what helps. And the opportunity to help others. We always feel better. It's a brain thing, literally. It changes our brain when we can extend and help others. And even students can do that. Having optimistic conversations is another resiliency factors. Yes, that's a struggle, and here's what we can do. Certainly staying in gratitude and perspective, and even helping our students, keeping a perspective that, you know what, yes, this is hard. I understand your worry, and you know what, we're all just struggling. It's okay. Let's just reset. Let's just come back. We're good. Keep the perspective. And then be reminded, Dr. Bruce Perry is quoted as having said, there is no more effective neurological intervention than a safe relationship. We can be that safe relationship for our students. Here's the challenge though. What we need more than anything right now is connection. What we're dealing with is isolation, social distancing, and masks. But that said, we can do this. So what does it take to do that? Let's frame that. What do we need and what's that going to take? Well, it's going to take some tools. We need some tools to thrive. And the first tool that we need is to remember to take this one step at a time. We need to take it one step at a time, having patience, having some flexibility or a lot of flexibility, and a lot of grit. It's going to take a lot of perseverance to see ourselves through this school year. And then helping our students know, hey, it's okay. We're going to take this step by step. None of us know what we're doing here. We're all facing something different. We all need to be flexible. It's good. You need to take it step by step. We know that we're all just trying to figure this out. We're all doing the best we can with what we have, with where we are right now. The attachment model, called the ARC model, is a model that I like to use to help us kind of look at how do we approach this. And the ARC model defines what children need for healthy development. Remember I talked about Amy got what she needed from in utero to when she was 5 years old, when she did that brain map. Predictable pattern, repetitive and attuned caregiving. Attachment, that's what she needs. Caregivers that can emotionally regulate, caregivers that can attune to her needs and understand developmentally what she's able to do and developmentally what she needs. Caregivers that provide consistent response and are able to create ritual and routine. That's the attachment level. When our students show up to our classrooms in kindergarten or before, then we become part of that developmental need for attachment, where we provide emotional regulation as the adults, consistent response, attunement to their developmental level, and to creating ritual and routine. Again, more challenging than this year, but we can do it. The regulation part of the model is helping students gain the regulation skills. One, to identify what they're, how they're feeling inside themselves, how to have the skills for managing emotional regulation, and how to have the skills to express what it is that they need. And then ultimately, that's going to help them be in a learning state so that they can academically achieve and ultimately grow into adults that are able to be in a positive state of well-being in all the areas that I mentioned in our previous training. So looking at that, as we approach what are students facing as they're coming back to us this year, we need to think about the same three things I mentioned in the last training: regulation, regulation, and regulation. We need to spend more time focusing on our regulation, being attuned to their regulation, and how we're co-regulating. Another three words that go along with that are listen, listen, and listen. Listen to yourself. How am I feeling? How am I feeling inside my body? Where in that scale of emotional reactivity, where in my brain am I living right now, so that I can take a breath and get to the state that I need to be in? Then I can help the student be able to calm down, get more regulated, take a break, reset, and come back and get on task, so that we co-regulate well rather than ramping each other up and having a very bad moment. In order to do that, we can use the ruler concept by Dr. Mark Brackett. He wrote a book called Permission to Feel and created the ruler acronym for recognizing our emotions. We need to recognize our own first, and then be able to recognize somebody else's, and in this case, our student. What is the emotion probably that they're feeling right now? How can I help them identify that? How can I understand my own and or theirs, and understand what's the trigger for this emotion? What's having you feel this way? Because if I can understand what's triggering the emotion, I can do an intervention that's going to address that trigger rather than just address the behavior. To better label emotions, helping students to label their own emotions. Anger and frustration are what it looks like. They probably are feeling some anger and frustration, but as I mentioned before, behind anger and frustration are at least 3 to 5 other emotions that if we help them identify those emotions, we can help them better regulate those emotions. And then learning the skills and teaching the skills this year and giving more attention to helping students express those emotions, but appropriately. Being able to ask for what they need, to know what they need and ask for it, to set boundaries with other students as they need to. And then to find the skills to regulate. What are the skills that they can use when they're feeling ramped up? They're feeling restless and they can't sit in their seat. They're distracted. They're emotionally reactive right now. What's the actual skill that I can be focused on and help them use so that they can manage their emotional zones? We are all in an emotional zone right here, right now. So be thinking always about what zone am I in and what zone are they in. Again, we can co-regulate. If we're in the blue zone, it's kind of when we feel low. We feel maybe sad, tired. It could be that we're bored. You know, that I know what I need to do, but I just don't have the energy to do it. Sometimes that's a lack of physical energy. More often, it's a lack of emotional energy that we need to attend to raise that level of energy. The green zone is when we're pretty happy, we're pretty calm, we're able to regulate and stay on task. We're feeling good, we're feeling okay, I can focus. I'm showing up ready to learn. That's the student state, of course, that we want them to be in, because without that, they're going to have a hard time being able to be in a state of learning. When we get into the yellow zone, we're starting to get frustrated. That's where we're going to see anxious behaviors, the wiggly, silly behaviors, maybe the angry behaviors, kind of that excited state where it's hard to regulate ourselves, and a loss of some control, not out of control, but just kind of a loss. You know, we all have that feeling where you're right on the edge, and if you say something wrong to me, I'm going to bite your head off. Now would not be a good time to be asking me that. We all know that feeling. Sometimes we still have the control to tell our kids that. And then we get into the red zone, where we are reactive, we are angry and mad, whatever that looks like. Sometimes we can be mean-spirited. It can have us raise our voices or even yell or get physical, and we get out of control. It's what it looks like for us, for our student, when they melt down, if you will. So let's think of some ideas for how to help regulate, depending on what zone we're in. And I don't have time today, I wish I did, but I don't, to think about what's the behavior and what's the specific intervention that would work well for that behavior. That's the kind of thing we do in our Thriving Students program when we coach schools and students, our teachers, on a particular student. But for today, I just have some ideas about kind of the principles that we need to come from as we think about interventions for our students. So when emotional behavior looks like misbehavior, start by looking at the misbehavior, whatever it is, and think this is an emotional behavior. So focusing on the emotion, what do I think the student's experiencing? What can I do about that emotion? We want to use strength-based statements. What is it that you do want? What would that look like? The skill to help you right now would be, I want you to take a break and go do this, and then we'll come back. Just knowing what they need, predicting and planning for that, so that we can divert what we know is likely an outcome of dysregulation that will turn into a misbehavior. So really focusing again on the emotion intervening with that emotion first before addressing the behavior. Another thing we need to do is ask important questions. We need to think about, as the staff member approaching, what am I assuming about this misbehavior? What am I assuming about the intent of this student? Is this directed purposely at me? Is he just being defiant? Does she just not care? Because that's what it looks like. And I'm assuming that. Ask what you're assuming, and then for just the moment, assume that you're wrong. What's the more positive possibility here that you could assume? She wants to do well. He wants to regulate. This is not directed at me. What's needed here is, what do they need and how can I provide it? What more do I need to know about them and what they're experiencing, what they're coming from? What haven't they been able to tell me? Just because at school it may not be appropriate, or they just don't feel safe enough to be able to share what they're dealing with at home. We might look at the Amy's and think everything's good from their home. She's coming from a good environment, but we don't know what family stressors they may be facing. Certainly the Tommies on the other end, what they're facing and dealing with. What don't I know? And assume that there's something going on that, again, is the driver for this behavior. What function does this behavior serve for the student? How is it helping them to get out of something or to get something that they're wanting and needing? The need is very real. How they're going about getting that need met might not be good, but we need to find a better way for them to get it. But it's serving a function for them. How can I shift that function, the behavior, so that they'll get what they need without it being a misbehavior? Another important question this year, more than ever for all of our students, is what break do they need? They're coming stressed, coming with a lot of unpredictability. Is it a sensory thing that they need? They just need a break. We need to get quiet. Or they need to go to a study carrel, put some headphones on, and get quiet, because I just know for this student that they go into sensory overload. They might need a physical break. They just need some movement right now. Giving permission for that break so that we can divert the behavior that will happen if they don't get it. What emotional break might they need right now that I can provide for them? We might think about, what break do I need right now? I'm fatigued. I'm emotionally stretched. I'm frustrated. I'm tired. What do I need? Think about breaks for the whole class way more often than this year, whether they be sensory or emotional or physical. We all need breaks to reset. As staff, we need to think about, how are we showing up? What emotional state are we showing up in? We need to be mindful and intentional about how we show up, because how we show up sets the tone for the classroom, for the moment, and for the day, and even for the school year. What we're showing up to this year is scary for us and uncertain for us. And it's even scarier and more uncertain for our students. But as Brene Brown reminds us, sometimes the bravest and most important thing you can do is just show up. And when we do show up this year, accepting always that we all, students, families, and us, we're all doing the best we can with what we have, where we are right now. So that said, I really, again, appreciate the opportunity to partner with the school district this year. And I'm partnering with you, hopefully in the stand, that we will all foster resilience this year. And at the end of the year, our students will not only have survived, we will not only have survived, but we will all be thriving socially, emotionally, and for sure, academically. Thank you so much.